So the US coronavirus death toll has now topped 26,000. The number of fatalities in the country's COVID-19 epicenter of New York City surpassed 10,000. And the grim tally comes as Trump pushes for economic reopening. The US president said that his plan to end the lockdown before May 1st is almost complete. This comes even as the president's coronavirus task force urges people to maintain social distancing throughout the month of April. Meanwhile, concerns are growing that COVID-19 deaths in New York are being underreported. Experts say that the tally should include victims of respiratory diseases who died before being tested for coronavirus. Let's get in a sense of what's happening on ground zero. For that, let's quickly go across to our correspondent Jagrati Dave, who's joining me live from Washington, D.C. at this hour. A very warm welcome to you, Jagrati. Now, let me begin by the entire bit on the funding to WHO. By cutting funding to WHO, many believe this decision is part of a broader effort by the Trump administration to curtail China's growing global influence, especially in international organizations like the WHO. What's your assessment?
Yes, indeed. That is a consideration that many people are making when they look at the Trump administration's decision to cut funding to the World Health Organization. There has been an ongoing tussle between the United States and China, most prominently on the trade front. And only very recently had they come to an agreement, a trade agreement, a phase one trade deal to allay those tensions that had been bubbling for the best part of a year and a half to 2 years. This decision, many of the president's critics also say, is an attempt to deflect from what they see as the president's own failings in this area. So the very things that he is accusing the World Health Organization of doing, mismanagement, slow responding in the early stages, are the very things that the president and his administration has been accused of with regards to their response to the outbreak in the United States. So multifaceted criticisms of the president's decision coming in. It must be said that the president's criticisms of the World Health Organization, that it's too China-centric, as he has put it, he is not the only one to have that opinion. There are conservatives here in the United States and others, some health experts, who do believe that the World Health Organization did give undue praise to China early on in the outbreak with regards to its management. And as Antonio Guterres, Secretary General of the UN, said that once the epidemic is over, then they can assess the roles of those involved and how they responded to the crisis. But now is not that time. Right, now is not that time, and that is something perhaps Antonio Guterres has also pointed out. But let's look at the figures in the United States. 2,228 deaths. Those are some new grim figures for the United States. Jagrati, what was the key focus during today's press briefing? So today in the briefing, really the focus was on the World Health Organization and the decision to halt the funding. A vast majority of that was spent, of the briefing was spent discussing that. The president also announced relief for the airline industry, one of the big industries that's been severely hit by the halting of travel, the social distancing, part of the social distancing measures and the shutting down of the United States economy as well as economies around the world. So those are some of the measures. That was one of the measures that the president announced in the briefing today. But there is clearly still a demand for protective gear for health professionals. There's still a need for ventilators and equipment to be sent around states, whilst the number is plateauing in states like New York. States like Washington and California on the West Coast have seen flattening as well. They've given ventilators that they had to other states. There's clearly needs in different areas, in different parts of the country, depending on when their peaks arise.
Right. And since you mentioned the plateauing of numbers, especially in places like New York, there's also talk of how New York's death toll has been underreported since New Yorkers dying at home has not been counted. The lack of testing being another factor. Do throw light on this aspect.
So there's issues regarding reporting. Dr. Birx, one of the members of the coronavirus task force, the coordinator of the task force, indeed, has talked about how states need to report accurately and consistently in order to feed the models that ultimately show projections on death tolls across the country. And this is clearly a problem with reporting, with determining deaths. There's inconsistencies, but issues with inconsistencies have arisen in other areas like testing as well. There was inconsistencies in testing right from the start, which is one of the criticisms that has been levelled against the administration's response. And there's still reports that there is not enough testing being conducted throughout the United States. So these kinds of reports continue to come through, and this is something that health officials and those who are monitoring, members of the task force, are clearly going to have to look out for and monitor.
Right. Jagati, before I end, the divide between the federal government and the states is, of course, very stark. In this battle of Trump versus the states, where several governors like Andrew Cuomo are against the easing of restrictions just yet, what does U.S. law state? Can the president or federal government force a state to lift its own social distancing policy?
Well, that is the issue that has been under discussion really for the last 2 days. Yesterday, the president talked about how the federal government, the president, has total authority, an issue that was disputed. He was challenged by journalists at the briefing, saying that it was not true, and that given that the president had said that it was the responsibilities of states and their individual governors to shut down their economies, it follows that it's also the responsibility of the states and the individual governors to reopen the economy. And today the president talked about how he was authorising states to reopen their economies in their own time, that he wasn't going to force or pressure state governors, and that they would do it, they would make the right decision. But many have said that the president actually doesn't have the authority to authorise state governors. The states already have that authority to do so themselves. And so different states, depending on the caseload, depending on the sad numbers of deaths in their states, they will make those decisions, and there are plans that are afoot. States on the East Coast and states on the West Coast are forming groups and are working together to find a coordinated way that they can reopen their economies in the time to come. But they've all said that they're going to do it slowly, gradually and safely.
Absolutely. In this time of crisis, this divide has actually thrown a lot of light on Donald Trump's presidency. We leave it at that for now. Thank you so much, Jagrati Dave, for bringing us all those details from Washington, D.C.